It's important to tackle youth unemployment, because youth unemployment means less families, less children, less future taxpayers and workers. That means more problem for tackling the pensions.
In Germany, there's a 6 or 7% gap between the marginal income tax rate and the corporation tax rate. Here, that is 30 percentage point gap at the average industrial wage. This clearly differentiates the employment experience of Germany, where unemployment is falling, youth unemployment is falling, and in Ireland, where it's chronically high. In Germany, and I will be brief, in Germany, the public and sector wage levels are broadly equal. In Ireland, average public wages are 47% higher than private sector wages. And finally, in Germany, there is less rigidity in the public sector, so that the essential task of cutting back spending can focus more on eliminating waste. Because of a rigidity in this country, we are seeing cutbacks affecting the poor. And I think those three essential elements should be debated.
Shouldn't we be more open about the fact that we cannot continue as we have in the 20th century and the first decade of this century, and that if we want to preserve social policies, we have to completely rethink them?
If you want to reduce security in jobs and permanence, then first you have to create new jobs.
Is there a possibility, referring to what you said in the beginning, that by 2014 it will be all labor flexibility and no social security?
There's a huge challenge as to how we're going to fund key areas, education, health and pensions in the long term. If we have models that fund them predominantly from taxpayers' current resources, and they are growth areas that are going to keep growing, because of aging and so on, well, we will run into huge funding crises. And I think we do have to rethink the funding models in those areas. In Ireland, we've had a mix of a public and private model of health. I think clearly we need to be able to make that funding model one that can get people willingly, voluntarily fund more part of their health provision than relying exclusively on the state.
I think the precepts of economics lead to very clear recommendations in terms of much greater flexibility in the factor markets and labour capital markets.
To my knowledge, hardly any country has talked about the level of pensions, which is a more difficult topic, and I wonder if somebody will dare doing so, and how it would be possible to sell it to the electorate.
In the future, what we'll see is that in emerging countries, the salaries will raise, and that means that the things we buy will be more expensive. And I think salary increases in Europe must be lower than inflation in the future to keep some kind of competitiveness. And that will be very difficult with labor unions, but I think if we want to survive, that will be the trend. If you look at changes done in Sweden, and especially in Germany, Hartz IV especially, so you control very carefully that you don't give excessive benefits through social security system. And that is one way to try to guarantee that you get your benefits only when they really are required. And I think that will be a trend in all European countries in the future. If I look, for example, at Finland and Sweden, so now we have tax deduction that is made on wage. That the purpose of the deduction is to guarantee that in all situations you get more in your pocket when you work than when you are on your social transfers. And that is working quite well. Two elements, if I may, to finish. So one is pensions. We have luxurious pension system. So in France, 62, impossible. I think it should be 72 in 10 to 15 years. So we can't afford paying these pensions in the future. So that will change. And flexibility, so it's not only that companies use labor to that degree, they need the labor, but then it's also in the working site. So people must work more effectively. And I think it means that in wage creation, so you must have a system where what you are doing, what the benefits, what the productivity is, that will be benefited more highly than today.